Hi viewers, my name is Aisha Jalil and I am Assistant Professor of Sociology in the School of Integrated Social Sciences, University of Lahore. I welcome you all to another episode of SISS Faculty Conversation Series from the platform of Center for Security, Strategy and Policy Research, University of Lahore. Today we are going to be talking about COVID-19 current and future challenges for public health. Since the outbreak began, we see that the rich countries have somehow managed to deal with this pandemic with their advanced healthcare systems and better public health policy. But the low-income countries such as Pakistan are facing multiple public health challenges. The entire humankind is experiencing this social distancing thing for the very first time on a large scale. The lockdown anxiety is hitting people alike from all over the world. The scientists are anticipating that we're going to have negative consequences of the social distancing and self-isolation experience because it is going to impact our psychological well-being and physical health. Besides, if we talk about Pakistan, besides protecting our public from this pandemic, it is equally important to ensure the safety and protect our healthcare workforce from the death, because they are going to be serving us in the future pandemics. So the situation is worse in Pakistan. We are unfortunately losing our very valuable healthcare resources in this way. And at individual and community level, people are unable to figure out how they can deal with this increasing number of coronavirus cases. So to elaborate on this topic, I have invited today Dr. Florian Fischer. So first of all, let me just introduce my guest for the audience. Dr. Fischer is a public health expert. He is affiliated with Institute for Gerontological Health Services and Nursing Care Research, Ravensburg-Weingarten University of Applied Sciences, Germany. Previously, he has been affiliated with Bielefeld University. My worthy guest has a very long list of academic and research contributions. He has authored more than 200 research articles in international peer-reviewed journals, and he has edited 3 books. He works on diverse public health topics, including but not limited to burden of disease, global health, infectious diseases, health communication, aging and health, nursing care, and health disparities. He is also a member of very prestigious international journals like BMC Health Services Research, BMC Public Health, BMC Women Health, and PLOS One. Dr. Fischer, thank you very much for being here. I'm honored that you took out time from your very busy schedule. Over to you now.
Yeah, so thank you very much for the introduction and the kind words. So it's a pleasure to talk to you, and yeah, it's also very important for me to get this connection between Germany and also other countries, because I believe that public health is not even the same in each country, like Germany or like Pakistan. So then we can have, I think, a fruitful discussion about challenges which COVID-19 might pose to Germany or might even pose to a country like Pakistan. So I'm very open to your questions.
All right, so my first question for you is, apart from the adoption of traditional public health response for preventing and slowing down the spread of infections, what else is needed to combat the pandemic?
Yeah, I think this question relates even to the distinction between measures of old public health versus new public health. Because if we think about the things which we discussed in old public health, it mainly focused on infectious diseases, it focused on hygiene and so on. And now in the area of, or in the era of new public health, we are also taking account much more the social determinants of health, health equity, aspects of justice, where we think about government regulations, social and economic aspects which are impacting on health. And I believe that these aspects are now very important in times of Corona and the time of Corona pandemic, where even the economic aspects have very much impacted on the health system of the society, but even on each individual. And for that reason, I believe it is much more than just this epidemiology or things which can be enforced by virologists and so on, because I believe that if we are talking about the effects of COVID-19, we also need to think about the social isolation, which might also be caused by COVID-19. That we have several vulnerable populations, for example, like the elderly or even like healthcare workers, which we need to address in much more detail. And we've tried to do so in previous research, but we've also tried to do this now, especially in times of COVID-19, where we try to address the needs of the elderly who are in particular vulnerable to COVID-19, but also in previous research, which we've conducted, for example, with your colleagues in Pakistan, about healthcare workers, about their anxieties, about their fears, which definitely need to be addressed.
All right, thank you. If the travel restrictions are lifted, what will be the international health implications in this period of uncertainty?
Yeah, I mean, a virus does not stop at a certain border. So we can see that we have some large global health implications here right now. So what we need is definitely a joint action, and also supranational approaches are needed. At the moment, I have the feeling that each country, or even when we have a look at the German system, each federal state decides on its own what to do. And this may cause some trouble because, as I've said, the virus does not stop at a border. But however, if we are now stopping these border controls, we need to think about how can we deal with the situation. I mean, this border controls or the restrictions in travel are only a temporarily solution, and now we need to go more to find immediate actions which have to be taken in a situation under large uncertainty. However, this travel system is difficult, because if we have missing immunization, if we have no vaccine, if we have uncertainty about the way how it can be transmitted, it is difficult to find the right solutions, how we can open up these travel systems again. And also it is about the science in general, because we now have kind of a distrust because of lacks in study quality. And from my opinion, we definitely need to get more into the field to see what this may feel, because we can see abstruse pictures at airports right now, and there are meters of distance before you enter the airport or before you check in. But when you're sitting, for example, in a plane right beside one another, this will have, I think, not so good effects on the spread of COVID-19, because we can, by opening, for example, the trains or by opening the airports again, it may force again that we have maybe something like a second wave. So we need to find solutions to secure the public in this area. Yeah.
Right. A lot of people think that this is the end of times, and they are worrying about the decreased lifespan. So what do you think about this public scare? People are unable to figure out to balance between fearing and at the same time staying strong. This is mainly the problem of Pakistani people today. I want to ask you if you could please tell how fearful one should be.
Yeah. I believe that fear is somehow counterproductive, but I believe that we do not need this fear, but maybe caution, because caution is very important at this time. So you need to be aware about how the virus can be spread. You need to be aware about the ways of transmission, and you definitely need to be aware about the implications of this virus on an individual and the society as a whole. But this is somehow now we are now in a stage where we really need to think about about something like fake news, for example, which are strengthening fears. We need to think about also other things where, for example, in Germany, many protests are still going on right now, where we say maybe the democracy is even questioned. So there are fears related to the virus itself, but there are also fears which are related to the effects of social isolation. And we need to have adequate and really reliable information. And this is now the time and the role of government and also media, which have to work now together to inform the people much more about the virus, to inform about preventive behaviors, to get really the health knowledge and into the public, to strengthen also aspects of things which we call in Germany health competencies, or needs to be definitely enforced right now to reduce the fear, but to be able to be cautious about all the things which drives the pandemic right now.
All right. Now, I would like to say that public health as a subject is about promoting the healthy lifestyle for better health and well-being of individuals and communities. So what concerns me more is the lifestyle of Pakistani people, which is mainly unhygienic. I think those who are washing their hands and fearing the germs are considered as the patients of OCD, and they are ridiculed and labeled as having OCD. If you are trying to physically distance yourself from the people and try to practice social isolation, people show weird kind of behavior to you. How can we deal with such public attitudes?
Yeah, I think from the perspective of public health, we are also always including social and economic environment, also the physical environment, but very important also the person's individual characteristics and behaviors. And for that reason, we distinguish between behavioral and also structural prevention. Both of them are important. We have now a view on those more or less structural aspects of prevention. We need to think about infection control management system, which definitely need to be strengthened, not only in a country like Pakistan, but also in a country like Germany. This relates to measures of activities in focusing on surveillance systems. We need valid numbers right now to make the right decisions. We also need adequate structures for combating the pandemic, like having enough intensive care units, having enough quarantine. But as you've already mentioned, also the person's individual characteristics and behavior are important right now. And we need to think about how can we bring the people to adequate hygienic washing, like physical distancing. And maybe I can talk about some things that we have witnessed here in Europe or in countries of Europe. We have quite very diverse ways how to deal with this issue. In Germany, it went quite well from the beginning on in March in 2020, where we enforced some kinds of physical isolation, but some countries have also gone other ways. For example, like Sweden, where several things were done in a different way. This was possible because Sweden is a country which is land densely populated, but now we see quite high numbers of deaths, which are leading even to distrust in the population. And for that reason, what we currently need is something like solidarity or altruism. And this is also something where we can bring people to act more in solidarity with others. And also the solidarity right now means that we need to be cautious with our behavior, that we need to enforce something like hand washing, like hygienic factors, and maybe it might be a help to see that this hygiene or this hand washing is not only needed to protect oneself, but it is also needed to protect others, and this definitely belongs to the humanity. And Currently, we are talking about something like what we call a new normality. I believe these factors shouldn't be only the new normality, it should have been a normality of the humanity before. So as mentioned already before, we definitely need information about the risk factors, but the problem we currently have is missing evidence. And what we also can see in European countries right now are aspects like conspiracy theories, where we talk about Bill Gates, where we talk about the vaccine industry, which may have an interest in getting money for providing a right vaccine. But overall, we definitely need to think about it more in detail. And what I've always said, health communication is a highly important aspect in this area, because now we need to find ways how to inform the people and to say these aspects are important for your own prevention, but also for the prevention of your loved ones, of your family. And now we need to find ways to communicate this to the people via the media, via social media, etc., to foster people or to strengthen those approaches of individual preventions to combat the COVID-19.
Right. Let us now talk about the economically deprived segment of the population who are more vulnerable to the environmental conditions as compared to the richest. Like in Pakistan, we have beggars on the streets and on the traffic signals and homeless people. They are important source of spreading the infections when they touch the cars and move around in between the people. Because of their environmental exposure, definitely. In the absence of social welfare system, how can we help those people in this time, and how can we protect them from COVID-19?
Yeah, I think this is a very important question when we are looking in the area of public health, because social injustices are in the heart of public health, and these social injustices may now be even caused by COVID-19, or they may be enforced by the corona pandemic right now. In Germany, we have some discussions about the additional burden, which may be even forced to females right now, the double burden for females who are employed and are mainly responsible for the childcare. This does not, I do not want to strengthen the stereotypes right now where female are doing more on childcare than men, for example, but it is frequently still the case. And this also leads to, let's say, social injustices. And so social injustices can also be seen much more in people like who have no home. And you mentioned this already, and you can also see this in European countries, that we have now a gap which is going much more to enforce. Because, for example, if you have a look at homeless people, what shall they do? I mean, if the government says, please stay at home, what should these people do? And this is also much more enforced in the current times, where we see that services which are supporting, for example, homeless people are closed. For example, services which help them with food, which provide a place to sleep. And if we see now that these services are closing, we can also have a double burden for those people who are already economically deprived. So we definitely need to find solutions which are promoted from the government, but we also have now in our times many people who are working to help other people on their own, to see that there is definitely a need to protect other people. And that is, I think, a very important point right now, where we should think about, and where we definitely need more support from the government and also other areas to focus on the need of really those economically deprived persons. So I think it is an area where we need further actions, but currently there is not enough attention paid to those people.
All right. how the health disparities would increase between the first world and third world countries like Pakistan after COVID-19. With this global pandemic, the underdeveloped and developed country gap is surely going to increase, I think. What is your opinion?
So definitely, I believe that it's a very practical example now of global health. I mean, we have the implications that COVID-19 may broaden inequalities even between the more developed countries compared to the countries which are still under development. And this is very crucial for the countries which have not developed that far right now, because we can see now the effects of missing resources, of an underdeveloped healthcare system, of missing or not well established emergency response to infectious diseases. When we think about some years ago to the Ebola crisis, we also made our experiences, and now we can really ask, have we learned our lessons? And I believe right now we have the same crisis also at the World Health Organization. A few years ago, the World Health Organization has been highly criticized because of their the way how they dealt with the Ebola crisis. And now we can also see this again when we have this very hard times, even now having a look at, for example, how the United States of America or their president Donald Trump acts, and how he says that he wants to cut his support of the World Health Organization. So what we can see now is that we really have a threatened progress to achieve the Sustainable Development Goals, which is threatened really by the implications of the coronavirus or the corona pandemic. And from my point of view, global health also needs to take into account the global economy, for example, other aspects like trade relations, because the economy also impacts and affects negatively health. And now we need to consider the broader picture. So from my point of view, I can just say that the social science approaches are much more needed. So we can see public health offers many instruments for doing so due to its multi and also interdisciplinary approach. And public health is now needed more than ever to deal with the direct effects of the infection, of the direct effects which are caused by the coronavirus. But we are also needed much more now to also have a focus on the indirect effects, if, for example, on vulnerable populations. As I've already mentioned, we are very much thinking about how to deal with the coronavirus pandemic, but we are also needing a much more stronger focus on the particularly vulnerable population, for example, like the elderly ones who are more at risk of coronavirus, but who are also more at risk for the maybe social isolation which may be caused. And so we can see a very, very broad picture, which now needs to be taken into account, that it is definitely needed to make strong systems for focusing on infection control, but we are also needing strong public health measures, which means we definitely need to take into account all those vulnerable populations, and we also need to think about what global implications will those factors have for the future on the global health area. So now it is a point, from my perspective, to get more into contact, to feel more and have more focus on the aspects which I've already mentioned about social injustice, social aspects of health, social determinants of health, which are now should now be in the focus in the corona pandemic.
All right, thank you so much, Dr. Florian. Here we have reached the end of today's insightful conversation. Dr. Fischer, thank you so much for speaking. I really appreciate that you took a time from your very busy schedule. Okay.
Yeah, so it was a pleasure talking to you, and I hope that we now have some further ideas where we can see that the coronavirus poses different challenges to the countries, different countries to the world, but where we definitely need a supranational global health approach to deal with those challenges we are currently ahead. Yeah.
All right, viewers, thank you so much for listening. Till next time, take good care of yourselves. Goodbye.
Thank you very much.